Keeping schools safe from COVID-19. Vaccines are one defense, but most kids are still waiting for the jab. In the meantime, testing is critical. Children often don't develop severe cases of the coronavirus, but they can spread it, putting teachers and families at risk. Antigen tests have so far made the grade, but is there a better way to stop the spread of the disease? I'm Ben Fazul and welcome to the show. Some German schools are now using the Lollipop test. Sounds like fun. Not all pupils are so enthusiastic about it, but better than a long swab up the nose.
Seid ihr alle bereit?
Are you all ready? 30 seconds, go. Then it starts, the Lollipop song. For 30 seconds, the children at this elementary school in Cologne suck on their lollipops, which are actually cotton swabs. The swabs then go to a lab where they are tested for COVID. This new method aims to make testing easier for young children.
Also ich finde den
It's quite good. It's definitely better than the nose test.
Der Nasentest. Ich finde ihn auch ganz praktisch.
I find it's quite handy because afterwards I feel safer about whether or not I have corona.
Oder nicht.
Aber der Geschmack ist ekelhaft.
But the taste is disgusting. I always try to think of lollipops afterwards, but the taste still doesn't leave my mouth.
Von dem Mund weg.
A cab takes the cotton swabs to the lab. It's a logistical challenge because another 500 schools are bringing their tests here. In the lab, the swabs are tested using what's known as the pooling method. This means all cotton swabs from one class are evaluated together in one test. This is because the lolly test is expensive. The state pays around €50 per analysis. If you take 20 swabs representing 20 students and divide them by €50, then you get a good price. Additionally, you would have to add the costs for logistics and the materials that are used, but I think we're absolutely competitive with the rapid tests. If the pool is positive, individual retesting is required. Generally, the lab doesn't deliver the results until the next morning, but that would still be early enough to break a potential chain of infection, says Annegret Quade. We are multiplying the genetic material of this virus by a factor of 30 trillion. This means that you can recognize a virus activity when it is very low, and not only when someone is highly infectious and already spreading their virus load amongst their peers. Here at the elementary school, several infections have been detected at an early stage using the lolly test. Although COVID cases are currently declining in Germany, the kids will continue using the test at least until the summer holidays.
Morten Rohwald is head of the tuberculosis program at FIND, the Foundation for Innovative New Diagnostics, a global alliance for the sector. In some places in the world, kids are being tested before all adults are fully immunized, but only in some. In the meantime, are tests an alternative in preventing the spread of COVID, would you say?
Definitely. Testing is really one of the most powerful tools we have to control the spread of COVID. We can use the test to diagnose new variants, and it protects those who are not vaccinated. And, to control outbreaks, you need to test, to trace and to isolate. And as long as the kids are not protected by the vaccines, we need these accurate, affordable and child-friendly testing strategies.
And we saw some more effective or efficient ways of doing it there and cheaper ways. Is testing children, though, any more challenging than testing adults?
Definitely. The challenges are really many. As one of the kids said today, the nasal swabs, they are very unpleasant. And it's often not easy to convince the kids to get tested. So if the child is uncomfortable with the situation, it runs around and then the sample quality might be below, and then the test is unreliable. So the Lollipop testing approach is really an efficient way to get a lot of kids tested at the same time.
So it makes more sense than the usual nasal and throat swabs. Are there any other alternatives in development?
Well, there are many different ways to to test, and we are constantly looking for less invasive methods like the nasal swabs, not the ones that go further in. But we're also looking at new innovations, and through funding from the German government, we're looking into, for instance, face masks, where we capture the virus in the mask. Other groups are looking at artificial intelligence, where you cough into your smartphone and then you have an interpretation. You can use smartwatches to monitor temperature. So there's a lot of things in the pipeline. So I work a lot on testing for children in tuberculosis. And one of the challenges we have here is that rely on the sputum. So that's the stuff you cough up from the lung. And it's really difficult for children. So here, we actually have to sometimes put a tube into the nose and into the stomach, and it stays there for 3 days. Then you wash the stomach for the back and get the bacteria up there. So we've used stool or the poo of the child as an alternative sample, and it works quite well. So, different diseases have different challenges, and children are always the hardest group, and we need really, new research and development to make this happen.
But I'm sure a lot of people, including kids, would be quite enthusiastic about the multitasking mask. Can you tell us more about that, how effective that would be?
Well, it's early days, and there's a lot of research being done at this at the University of Leicester in the UK and by other groups. And it's only being explored in adults at the moment. And, So we're seeing good results for COVID. We are starting to see the best new results coming up also for TB. So clearly it's an opportunity to potentially test for multiple diseases using this approach. And, once we are out of COVID, it might be useful for RS virus or flu or that kind of thing.
But Morten, whether or not we're talking about little or big human beings, the thing about rapid tests is that they're quite likely to deliver those false positives we've so often spoken about on this show. Is there any way around that?
Well, we are looking a lot at trying to find simpler and affordable tests, and it's very important to always have evaluations that compare different tests against each other, so you actually choose the best kind of test in each class. And we're working here with partners across the world to make these independent evaluations. For instance, University Clinic in Heidelberg and Charité in Berlin. And some tests are better than others, and we basically need to try new approaches. And for me, the Lollipop approach really seems to be a great invention for the situation right now in Germany with a relatively low incidence. It seems the right thing to do.
Morten Rohrwald there, head of the tuberculosis program at FIND, the Foundation for Innovative New Diagnostics, with some innovations in testing and the importance of testing for children. Thank you very much.
Thank you.
Your turn now. Here's Derek Williams with a viewer question on vaccines and variants. Are the current vaccines causing selective variants to surge?
This is another of those internet rumors that's gained some traction in the last few weeks because somehow it sounds like it might be kind of plausible, but it actually isn't. To explain why, I have to go over some of the basics again. All viruses evolve randomly over time as they replicate, and a minuscule number of those mutations will prove advantageous. Let's say that one of them makes a mutant a lot more transmissible in humans. Voila, a potentially dangerous new variant. Over time, that variant's offspring could start to supplant earlier versions of the virus simply because the variant spreads to more unprotected people in a population within a shorter period of time because it's more transmissible. So when you start to look for that variant specifically in that population, you see increasing numbers of people getting it, a surge. But that's an effect that can be traced back to the variant's ability to spread faster in people with no immunity, not something that's caused by or driven by vaccines. What vaccines do is turn unprotected people into protected people with immune systems that are quickly able to shut down any subsequent infections with SARS-CoV-2, whether that infection would have been with a fast-spreading variant or a slower-spreading one. In other words, they keep us from turning into virus factories where the pathogen can replicate a lot. And the less the virus replicates, the fewer chances it has to mutate. So in the long run, vaccines will actually help prevent other potentially dangerous new variants from arising by slowing and stopping the spread of SARS-CoV-2 and drastically reducing the number of times that it's able to make copies of itself.
Finally, we asked children aged between 6 and 15 in dozens of countries to take part in a project recording their impressions of the crisis. We leave you with their drawings that not only convey their sadness and loneliness, but also the admiration they have for doctors and nurses.